Hello, everybody out there on Facebook. It's been 48 hours since my quarantine was over, so I'm sitting on my front porch because I can and having my after dinner glass of wine. It's a Tacoma from Peru. I can't even replace it. It's been brought to friends of mine who are from Peru. So if anybody knows anybody in Peru, send me some. My God, this stuff's good. Anyway, so today's COVID tidbits. The CDC recently published a study talking about some of the symptoms that people experience. And there was it's a small study, but it's a study they published recently. It talks about 3 of the most common symptoms. And they are fever, cough, and shortness of breath. Now that sounds like a lot of respiratory illnesses, but if you start seeing enough patients with this, you start to notice a slight difference in the way it presents with some of these patients. Some of them don't even realize they're having shortness of breath, I've noticed. Their respirations will have increased. They may not look the right color, not necessarily blue, but they just don't look right. Or they're running a small fever and they don't even realize that they have that fever. Low grade temps, I'm talking like 99.6, which technically isn't a fever, but that's how I found a lot of my patients who have ended up with pneumonia caused by COVID, and they've slowly deteriorated after that. Some of them, by the time I find they have what normally constitutes a fever, like 101, 102, they're not gone, but they're in pretty sad shape. So the study was extremely small, only involved about 164 patients in 16 states between the months of January when we started down this path and April. So, but it's to the average person out there, it doesn't mean a lot, but to those of us who take care of these patients, who take care of patients in general, it's something to kind of spot. Normally we look for this for like flu or just pneumonia, but now we also, when we see this in patients, we have to think COVID, even for low-grade temps. I've checked out, I've been asked to look on patients who have a fever of 99.1, but in that they look perfectly fine. Listen to their lungs, and like, oh, a little bit of some sounds down there. Let's do an x-ray. Oh, wow, you have bilateral pneumonia. Did you know that? No. So you end up having to treat that and also test them for COVID. Flu season's coming up, so we're going to be testing people for COVID and flu at some point, I'm sure. It has been kind of a rough couple of days at work. I've had some patients who have returned back from the hospital from COVID pneumonia, and some of them are doing very well, some of them are not doing so well, and it's kind of sad to see, how much further they're going to go in their recovery. I don't know. Pneumonia, period, when you get it severely, it doesn't matter if it's bacterial, viral, if you get it bad enough, the recovery time can be really hard. It can actually be a very long time, even though you may be able to get around even. You're still not feeling your best because of all the damage done to your lungs. But anyway, so that's it for today's COVID tidbits. Remember, everybody, to maintain social distancing, wash your hands, use the hand gel, and by all means, please wear a mask.